Well, I've got Anne Corlett and Clare Bettison at MHK up here at Salisbury Nursing Home. It's the 1-year anniversary, and I thought it was a good chance to get you because I needed a political thing to do here because there was controversy, and we had this big interview, and I don't know where it was going, but there was space available, and they weren't happy with the contract and that sort of thing. I'm just rounding it up. You have to look at the video to see the whole thing. So with your political hats on, because you're both in this sort of thing, what is the problem here? Is there a problem or what?
Well, as far as beds are concerned, we're full. The beds that we commissioned are
Initially,
full,
it took a little bit longer than we'd anticipated to get the beds up to capacity, and I think that caused a little bit of uncertainty on both sides. Nursing home markets, you can make a best guess as to how many people will need it at any given time, but it is a transient thing. The monthly statistics can change in terms of the bed capacity, if we've got more people on the waiting list, no beds, or if we've got some beds available. So I think there was a little bit of settling in terms of the new capacity coming onto the market, people deciding where they might want to sit, and that I think is probably what's led to the questions.
As far as it's covered now, as far as cost effectiveness is, we have enough beds occupied so that we don't have any.
Because you were paying for beds that no one was using, I think was one of the headlines of that interview.
That's not the case.
So now you're full.
And I think there was always going to be an element to that. When you open a new nursing home, you don't immediately fill every bed. And I've worked in nursing homes, that's my background, and we used to have phased implementations. When you opened a new home, you'd put first of all 10 people in, let that settle in, do any snagging, identify any areas where you might need to change stuff, improve things, where you're going to allocate your staff, because actually when you get on the ground sometimes it doesn't work quite how you thought it might do on paper. So it's a logical approach to have a staged admissions process to a new home.
And that takes time to bed in.
Happy with what you see here?
Yeah,
it's lovely. It really is a lovely place to be.
I think we're incredibly fortunate because actually when you get a new build home, you get wider corridors that can accommodate wheelchairs to pass, you get bathrooms that are actually workable. You can go in there with a wheelchair and a carer to support someone, and that's what we see here, is the capacity, the space, so that people can live comfortably with whatever disabilities and care needs that they have.
Yeah, it's light and bright, lots of windows. You feel like there's a lot of space.
Well, to finish with, I must ask you, are you both happy in health? I mean, you've been in, out, shaking all about. Where are you now? You're back in, aren't you?
Absolutely, I'm back in. I think I went in because I wanted to make a difference to health. When things weren't going necessarily how I thought they needed to, and I thought there needed to be a change in direction, I had to make a statement because that would be on my conscience. And I'm very happy with where we are now. I think that there's lots of work to be done. Health is always a movable feast. It's something we'll never have finished. We'll never be there. I think there's always developments in terms of what we can offer, in terms of how we offer it, best practice, and we need to be moving with that tide, as well as looking at how we operate within the financial envelope, which has been very well discussed, and rightly so.
And you?
And I'm very happy, always have been. This is the place I want to be. I feel you can do so much more on the inside than you can ever do on the outside, shouting, asking questions. I've always told the Chief Minister if he wanted me out, he'd have to sack me, because I'm not moving.
I mean, how much banging the table is still about getting more funding? Because I mean, I think today the UK's issued another $4 billion or something to their pot. I mean, it must be an uphill struggle, right, getting funding.
I think it's a balance, because you've got to look at how much realistically we can bring in, where we allocate our resources and what we spend it on. So there's lots of stages in that process. I certainly don't want to see us cutting services just without any due consideration. I think that's a very dangerous, slippery slope to get into. Yeah. So it's looking at those things where we can restructure, where we can provide actually the same service within a smaller cost envelope by running it more strategically soundly. And I think that we've had lots of complaints levelled against the health service, and actually in some cases rightly so, where things haven't been as organised as they could be, and that's led to unnecessary expenditure. So for me, those are the things we should be addressing first. There are some things, as with all healthcare services, where you have to introduce a new service because something becomes available on the market, and absolutely it's the right thing for us to do, and we have to find the way to absorb that, and that's not always easy. So I'm very, very positive about the work that's going on with Sir Jonathan Michael. I think that's going to be a very positive piece of work. I think the scope of that is exactly where it needs to be, and I'm very keen to work alongside that with Department of Health and Social Care, I think, as we both are, to make sure that that's a success.
Definitely. I think that's a really good move forward, and I hope that it'll implement the efficiencies, because this is what we need, is efficiency, not cuts.
Finally, with nursing homes in mind, the things that we always see, these stories that people have to sell their houses to fund their own end-of-life nursing home sort of care. Your thoughts on that?
Well, actually, on the funding of nursing home committee that's up, and we're just actually producing the first part of a report in the next month or so. It's a difficult situation, isn't it? Because it's not fair. It's really not fair. And I don't think anyone has any objection to helping people that don't have the money to do it. I think the arguments come in when you've earned the same as I have, that I've bought a house and saved me money, but you haven't. But we've both had the same opportunities, and then you are going to have your nursing care for free, and my house and my savings will go.
I hear this all the time.
Perfectly,
I think everyone says that.
You know, that is a valid argument, and I do think we have to find some way that at least makes this a little bit fairer.
Yeah. I mean, I obviously have followed the work that the committee are doing. I think that there's some very valid arguments that have come in, as we all agree on. I think that I've had them from the public. I think there was some really positive stuff came from the Positive Action Group meeting that was on at the Legion about this topic. The focus groups have brought information in. But I think there's such a large number of people that are involved in this, or have been historically, because it's affected them. And I think we really do need to find that solution. I don't think there's always going to be a simple solution to something like this. And I think one of the things that I was surprised at that came out of the work of the committee was that actually it's a very small number of people who ever actually end up in a nursing home. It's around 5%, I think, in total. And so it's not quite as drastic as probably in my mind. I probably had an idea of about 30% maybe of people who were going to go into homes. So it is a smaller number in terms of the population in total, but it's looking at how can we make that work better. I think there's community options we're doing in terms of more home care and allowing people to stay in their own home for longer with care packages. But again, there's funding questions over that.
Yeah, and around 50% of those in homes are self-funding.
Yeah.
So that's although it's not huge numbers, it's a big percentage that are having to do that.
So when is this going to come out? We can have a report on this, you say?
Actually, I think it will come pretty soon now. It's only an interim.
Right.
And at the end of the whole thing, I think hopefully we'll have some options rather than recommendations, something that can be discussed and decided, rather than saying we recommend this or that or the other.